Feline Pancytopenia is a condition in cats defined by low levels of red blood cells, white blood cells, and platelets. In Latin, pan means all or of everything, while cyto refers to the cells and penia refers to a deficiency or lack of. Pancytopenia therefore literally translates as all of the cells are deficient or lacking. Pancytopenia can be caused by many things, including drugs, toxins, infections, and immune disorders. There is currently an outbreak in the UK, potentially linked to some cat food, although the link is yet to be proven. Until we have more information, please stop feeding your cats any of the recalled food items immediately. Pancytopenia is a combination of anemia, leukopenia, including neutropenia, and thrombocytopenia. All of our blood cells are produced in the bone marrow, starting as stem cells and maturing into cells with specific jobs. Red blood cells carry oxygen around the body. The body needs oxygen for almost every function to stay alive. When levels are low, this is called anemia. Severe anemia will mean the body must work harder to supply oxygen to its vital organs. The heart will pump faster, the lungs will breathe harder, and the body will work slower to address the deficit. There are many types of white blood cells in the body. Perhaps the most important is the neutrophil. White blood cells generally fight off infections, with neutrophils being the frontline defence against most bacteria. Low white blood cells mean the body is vulnerable to infection, which can become severe very quickly. This is known as sepsis. Platelets are cells that act as plugs in the blood. They encourage the blood to clot. When a healthy cat gets a cut or bruise, platelets will bunch up where the blood vessels are damaged to stop blood from escaping circulation. Low platelets will mean that your cat will bleed very easily, and any bleeding is likely to be more severe. This can lead to anemia, sometimes very quickly, which is hard for the body to respond to. Finding the cause of the pancytopenia is extremely difficult, as there is no specific blood test for many of the causes. The cause of this current epidemic is currently unknown. However, there is a suggestion it may be related to a toxin causing an autoimmune reaction. This is where our own immune system can mistakenly destroy our own cells. The most common signs in feline pancytopenia include lethargy, little to no appetite, heavy breathing, pale gums, minor or major bleeding or bruising, blood in the stools or urine, or a fever. This is not an exclusive list. Pancytopenia can be easily diagnosed with a blood test, often before any signs present. There is currently no cure for feline pancytopenia. Medication can be used to treat an autoimmune response and other complications of the condition. Steroids will suppress the immune system from destroying its own cells, but please note, steroids can take time to work, at least 4 to 7 days in most cases. They may also need to be continued for some time, even if your cat's cell counts improve. Other medication can be used to suppress the immune system too, including a powerful drug called cyclosporin. Antibiotics will help tackle bacteria whilst your cat's immune system is compromised. They are not guaranteed to work against all bacteria, and your cat will remain susceptible to other organisms. Other medications, like tranexamic acid, can improve the blood's ability to clot, but does not replace the function of platelets. Anti-sickness medications and appetite stimulants may also be useful. Given the ongoing risk of bleeding due to the low platelets, you should restrict your cat from doing any vigorous activity that could cause trauma, including excessive handling. If your cat's red blood cells are really low, they may need to be replaced via a blood transfusion. A blood transfusion involves removing blood from another cat and infusing it into your cat's circulation. The donor blood and your cat's blood must be compatible, or else your cat's immune system will destroy all of the transfused cells and can make your cat more poorly if the reaction is severe. Most cats, around 90%, are type A blood type, but some popular breeds, such as British Shorthairs and Ragdolls, are more likely to have the rarer type B blood. If your cat needs a blood transfusion, your vet should take a sample of their blood to find out if it's type A or type B. This is called blood typing. The donor blood should then be combined with your cat's blood to check for any reaction. This is called cross-matching. Unless it's an emergency, Your cat should ideally not receive a transfusion unless it has been cross-matched. Even with a cross-match, blood transfusions carry risk of cross-infection and other reactions. It should also be noted that donor blood can be very difficult to get hold of in the UK. Your vet may be able to order some from other countries, but please be aware that this can be very expensive. Ultimately, please seek and follow the advice of your vet regarding the potential need for a transfusion. So far, the recovery of affected cats appears to be rocky. The mortality rate is still very high at 72.5%. Cats are very good at hiding symptoms of illness. Therefore, if a cat is showing symptoms, it may be very poorly, as they are no longer able to cover up their illness. Even the cats that are caught early appear to have a very slow response to treatment. Cell numbers may drop and rise, and treatment may be prolonged. Therefore, the main goal of treatment at present is aiming to prolong the life of your cat, hopefully long enough for the toxin to stop destroying your cat's cells or for the treatment to work. There is also ongoing research by the Royal Veterinary College and Food Standards Agency which will hopefully help identify the cause and provide a treatment solution. However, this may take some time. In summary, reduce the risk by regularly checking recalled food lists and immediately stop feeding your cat if you know the brand you use is affected. Spot the signs by knowing the symptoms and vigilantly watch your cat for any change, especially if they are at risk. Contact your vets and arrange an appointment to have your cat's blood tested. Your cat probably won't like it, but it may save its life. Be aware of the complications and what different treatments are aiming to do. Hopefully you can use this information to further your understanding of your vet's treatment plan for your cat. Help others by raising awareness. Be supportive to those that have been affected and counsel those who are grieving. Thank you for watching. If you think any of the information in this video is incorrect or misleading, we apologise. Please help us make changes by contacting us or commenting below. Thank you. I hope you enjoyed this video and found some of the information helpful. If you did, please share it to others. We want to save as many cat lives as possible. For all the cats and cat owners affected by pancytopenia, we are thinking of you and sending all our love as we continue to grieve for Eddie and pray for the recovery of Cassie.